I think a lot of people don't understand that Alzheimer's is not just an old person's disease, and that it's not typical aging. My wife was diagnosed with young onset Alzheimer's in 2010 at the age of 56. I retired almost immediately, quit my job of 34 years so that I could take care of her full time at home and spend as much time with her as I could. I took care of her 24/7 at home for a little over 2 years. I ended up having to place her in a facility, a dementia care facility, where she's been for the last 5 years. And in that time, I've spent $460,000 out of my own pocket because her care is not paid for by insurance, by Social Security, or anything.
Yeah, my husband Bill was in his early 50s, and he started having cognitive difficulty, especially with his speech. And he wasn't diagnosed with dementia until 4 years later. My husband died of Alzheimer's disease just shy of his 64th birthday. Over 5 million people have this disease. It's the 6th leading cause of death in our country, and in California, it's the 3rd leading cause of death. So to think that there's that many people with a disease that isn't on the front page every day, I think is actually pretty surprising.
I think one thing that's not well understood is how difficult it is to be a caregiver. It becomes a big burden on you physically. It's a huge burden on you emotionally. It can stress the family out. 50% of caregivers die before the person that they're giving care to. Congress can approve the increase in funding for research at the National Institutes of Health.
An investment in basic research for Alzheimer's is cost saving, that our country will save a lot more money if we find the right cures for this disease.
There's actually kind of a stigma about this disease that I think we need to take away and bring it back into the light. This is a disorder that we need to be talking about, we need to be angry about it, and we need to find a cure.